capacity and capabilities, and we couldn't be more thankful, in particular this weekend of holidays where personal sacrifices were made in caring for our patients, their families, and our communities. Hartford Hospital has been serving this community for the last 166 plus years. And this year and the last year has been in particularly challenging, and I am so grateful to our staff, our physicians, nurses, and all individuals who care, who stand here in front of the disease to take care of people. I wanted to also thank our clinical leadership here today, Dr. Wu and Keith Grant, who are here in providing their personal expertise. Their leadership in fight against pandemic has been profound, and we are really grateful for their contributions over the last few years. Before I hand it to our senator, I wanted to send a message to our communities that please be vaccinated, please take your booster, and please wear masks. The fight against COVID will continue, and we will be stronger and better because of those precautions that we are going to take. I want to thank Senator Blumenthal for his years of service and advocating on behalf of our state and for our country. He has been a staunch head of our efforts and a cheerleader to us in promoting health and well-being of our communities, and in particularly for the state residents of Connecticut. Senator Blumenthal.
Thank you. Well, I want to thank you for that introduction, and thank you to the folks who are here right now, the docs and administrators. The heroes are really here and inside this building and all around the state of Connecticut in providing the kind of world-class care to the people of Connecticut hour after hour, day after day, month after month during this COVID pandemic. We have healthcare heroes who have put their lives on the line, who have risked themselves and their families to provide the kind of care that the people of Connecticut need, indeed the people of our great nation. And we owe them such a debt of gratitude and thanks. So as we approach the new year, I am here at Hartford Hospital. I will be going to L&M. On other days this week, I'll be at federally qualified healthcare facilities, simply to say thank you. Thank you to the docs, the nurses, the staff, the folks who clean floors, all of them. They are modern day healthcare heroes, and they've helped save lives. I want to enable them to get out of the COVID business. We have within reach the means to conquer this pandemic, because the lines here include people who need cancer care, other kinds of care for healthcare issues that have continued during this pandemic and have put them, patients, at risk. And the COVID challenges are only one part of what they've had to confront. So just to echo what's been said already, vaccinations, boosters, masks, and yes, testing. Testing is critical. And one point I want to make is that people can help protect themselves by using these at-home rapid tests. They are in short supply. In fact, they are in dire shortage. Going to pharmacies, going to the testing sites. I've just come from New Haven, where the line is miles long. I know it sounds like an exaggeration. The lines are miles long at our testing facilities. And the rapid tests are unavailable in a lot of pharmacies. The federal government must use the Defense Production Act to produce many multiples of the $500 million the president has promised in January. In fact, we need $1 billion, $2 billion, or more of these kind of rapid tests. Now, a negative test will provide assurance to people that they can go to school, go to work, and a positive test should lead them to go for a PCR test, a molecular diagnostic test, which is the gold standard. But these rapid tests need to be made available. And I'm calling on the federal government to establish a pandemic testing general to head a board that will use the Defense Production Act to make billions of these tests, not just $500 million as the president commendably has promised, but many more, which are necessary for people to feel safe enough to go to work or school and enable us to go back to normal. These tests are literally key to the United States returning normal and the world, so we need more of them. In the meantime, I want to just reiterate the thanks that I feel, and I know I speak for hundreds of thousands, millions of Connecticut residents, in expressing my gratitude to the healthcare workers who are here, as well as the emergency responders, the firefighters, police, who will turn the new year still under tremendous challenge as a result of this pandemic. And thanks to all of you for being here as well. And keep testing. Get vaccinated, get boosted, keep testing, wearing those masks. Thank you.
Senator, did the president already enact DARPA?
I'm sorry?
Didn't the president already enact defense appropriations?
The president has referred to the defense, using the Defense Production Act, but only to produce $500 million. He actually made reference as well to establishing a pandemic testing board, but so far has not implemented it. So I give the president great credit for focusing on testing and for committing to $500 million tests, but we need more according to the public health experts. And we should not be lurching from emergency to emergency. We should be stockpiling these tests in the strategic national stockpile, which exists, but does not have these kinds of tests. In fact, the CARES Act required that there be stockpiles of these tests, but unfortunately, none has been acquired.
Senator, have you conveyed to the Biden administration that you want to see more aggressive production of these tests, and what has been their response, or why hasn't that happened?
The White House is very positive about the need for more tests, and I'm hopeful that they will take action to actually implement the Defense Production Act. Remember, what this act does, it dates from the Korean War, is to enable the federal government, in effect, to increase capacity on assembly lines of related industry, commandeer those assembly lines to produce more of what's needed, whether it's in wartime, tanks and other armaments, or in peacetime, ventilators, tests, and other COVID-related equipment.
What's the next step after he's referred it?
After he's implemented the Defense Production Act?
No, you said he referred it. Where did he refer it to?
I think Dan referred to referring it. I'm talking about implementing it.
No, you said he had referred to the defense.
Oh, he referred to a Defense Production Board, a about a year ago, in fact, he made mention of it. He didn't refer it legally.
So it's still not done.
Still not done.
Dr. Wu,
That's why I'm calling for him to implement this measure. And again, just to be clear, use the Defense Production Act immediately to commandeer assembly lines that are capable of producing more tests, because the tests are vital to people knowing in their homes. They can test themselves in their homes. I did it Saturday night. It's simple, easy, rapid, and in fact, the detect test is produced right here in Connecticut, but it needs help to produce many more of these kinds of tests. And a Defense Production Act implemented by a general, because it is in effect a war that we are in the midst of conducting. We are now in a moment of maximum danger as people come together for the holidays and positivity rates spike. We need to assure people, and they need to assure themselves, that they are doing everything possible to stop the spread. That's why the tests are critical.
Dr. Wu, you have said you worry that the tests sometimes give people a false sense of security, especially if they test negative, given the margin for error. I'm wondering what role you think tests play right now in the state.
That's a very good question. So with regards to the performance of the test, it really depends on what is the likelihood that anybody is going to be infected. And in a time where the epidemiology is increasing and COVID cases are increasing, a positive test certainly gives us reassurance that that is a true positive. With the negative test, it really depends on what your exposure is and how you feel. Obviously, for asymptomatic people, the testing may not be as good as somebody who is symptomatic with regards to a negative test. But it does provide some reassurance when you have a negative test that it could truly be negative at that point, especially if you are asymptomatic at this point. So there is benefit to testing.
So do you agree with the approach of distributing millions or even several billion tests and having people do them regularly?
Testing is definitely a part of this fight. We've talked about boosters, we've talked about vaccinations, we've talked about masking, we've talked about social distancing, we've also talked about not putting yourself in a social situation where it may be risky to acquire COVID. But yes, testing is also a part of that.
How accurate are those? People have obviously gotten together over the holidays. Are you concerned about this? Are you bracing for a wave? What should people be doing if they know they were in a family gathering and wanting to get tests? What's your expertise?
So to answer the first question, the accuracy for a positive test is better than the accuracy for a negative test, but the negative test does give you some reassurance. To answer your question, what is going on? We are all worried about Omicron, but we've always said that the issue here is not Omicron. The issue has always been the boogeyman in the house, which is Delta. So our behaviors with Delta that has been occurring since the summer should not really be any different from the way that we approach Omicron as well. And so are we seeing a rise in cases? Well, yeah, but it's multifactorial. It's due to waning immunity. It's due to colder weather, people cohorting indoors. It's due to the unvaccinated. It's due to social behaviors where people are just gathering because they're just tired. They're fatigued from COVID. So I don't know if I answered your question, but the rise in cases is due to all of those things, but we shouldn't attribute this to just Omicron because Delta has always been here and has been causing a lot of problems, unfortunately, over the last few months.
Can you give us an update on what you're seeing in terms of admissions in the hospital right now?
Sure. So we are seeing across the state admissions are rising, but the thing that we look at, and especially it's not just Hartford Healthcare, but completely across the state. But the thing that we're going to be looking at right now is the positivity rate in relationship to the hospitalizations. We know with Hartford Healthcare We are not at the number that we were at last year during this time. Too many people in the hospital is still a bad thing, but not being near where we were last year, that is a reassuring sign. But we're looking for the trend. We're looking to see what direction it's going in, whether it's going up, whether it's going down. That's going to be very important. But we're not just looking at hospitalizations anymore. We are looking at the case positivity with regards to hospitalizations.
Do any of you have data on the current capacity at Hartford Healthcare or Hartford Hospital specifically, both for the hospital and for the ICU specifically?
Yes. So alluding to where we were last year, we are we have sufficient capacity. We haven't canceled anything. We're going to continue with our other healthcare business as usual, but we have the capacity. We have very important, smart people who know this information, and we are reassured that we have the capacity to continue to treat. There may come a time where we may have to go into a contingency or crisis mode, but that time is not now. But we are looking at it every single day. We're almost looking at it by the hour.
So how close are we to that contingency or crisis mode?
We are not close right now.
When you say
It's so difficult for people to get an actual COVID test, a PCR test. I know people, at least at Hartford urgent care, have had wait lines of up to 4 to 6 hours. It's been impossible to be able to get a test. What is happening? It feels like it used to be so easy. Now it seems it's almost impossible to do that.
It's simply demand. The supply is there, but it's a matter of getting access and providing as many access points for the citizens of Connecticut. And that's why I think it's a very good point. We talk about the at-home tests because we're basically increasing the access points at that point. So the demand is up, and there will be a time where demand will be lower and the throughput will happen a lot faster. But right now, in this crucial point, because of the weather, because of the holidays, because of the cases going up, people are going to be going back to school. They're going to require testing. Demand, people want to go to parties. Demand for testing is going to be increased.
and your
So-
recommendation for parties this weekend is?
My recommendation for parties is all dependent on what your personal risk assessment is. If you put yourself in a risky social situation to acquire the disease, there's a good chance that you may acquire the disease if you don't take precautions. That's why we say it's not just one thing. It is multifactorial. It is vaccinations. It is boosting. It is testing prior to these parties. It is masking. It's social distancing. It is not putting yourself in those risky social behaviors. So everybody has their own personal risk assessment. But right now, in the time of rising epidemiology, if you put yourself in a risky situation, there is a chance that you may acquire COVID.
Quick question, maybe for the hospital president, I don't know. But a lot of hospitals are either understaffed or have a lot of staff who are out with COVID or are just torn down from the last few years. To what extent are you here kind of stretched thin from a staffing perspective, and what issues may that cause?
Yeah, I think the question is about the staffing at the hospital and in general within healthcare. It certainly has been a concern. We have taken, anticipating this challenge of our current times, put measures into place and taken steps to avoid the best we can. So I wouldn't say it's 100% perfect, but we're in a much better shape and condition than many other organizations in healthcare in the state and across the country. Just an example, not too long ago, we've been getting patients from out of state. And so from the physical capacity and the staffing capacity, we've been able to manage reasonably well compared to many others.
How is the, if the numbers are okay on the staff, how is morale and the workload? And I'm hearing a lot about burnout.
Yeah, I think one thing for sure that everybody, including the healthcare workers in particular, are tired and fatigued for sure, but their spirit is pretty high. I mean, we've been spending some time, I was here on a Christmas day talking with the staff member, as I was talking about earlier, the personal sacrifices people made to be here. One ask that our staff normally would like to make is to make sure people are vaccinated. make sure that you're taking appropriate precautions and not make the workload worse for them. And they are concerned equally about the community and want to make sure that we are in better protected space rather than unprotected space. So they're, even though tired, their spirits are high, and they are very engaged, and we couldn't be more proud of what they're doing today.
Senator, I have a somewhat off-topic question for you. You've talked a lot about how the airlines have been responding to various issues, and there were obviously a lot of cancellations over the past weekend. What are you looking to see from the airlines responding to those cancellations?
Well, first of all, let me say that there have been a lot of cancellations, as you know. And the airlines have to be responsible in encouraging people who have been infected to stay home and quarantine. Whether they planned correctly, whether they are to be blamed for these cancellations is a question for another day. But right now, we know for sure they owe refunds. And I have written to the airlines about 10 days ago demanding those refunds, rescheduled flights, full credits, because their past record provides scant assurance they're going to do the right thing on their own, voluntarily. So people should know they deserve refunds if their flights are canceled, and if there's a failure to provide rescheduled flights, or they deserve full credits. And we're going to be demanding that they do the right thing here, because they failed to do it in the wake of the last lockdown when there were also numerous cancellations. They still owe money to consumers from those last round of cancellation. At a hearing in the Commerce Committee just about a couple of weeks ago, I asked the airlines to commit that they would provide refunds, and they did, but we have yet to see those refunds, in fact. And we are going to be on their backs, making sure that consumers are, in fact, provided with what they deserve. It's not beneficence. They owe it to consumers when they cancel flights. And we're going to seek enforcement of that obligation.
Have you heard back from them?
How do you feel about people being required to be vaccinated on planes?
Should there be a requirement?
Yes. How do you feel?
Well, I think there is a need to consider it. The airlines told me at their hearing, in fact, the head of Southwest told me, Mr. Kelly, that there was no need for masks. And sure enough, a couple of days later, he tested positive. So I think the airlines really need to step up, and there may be a need for vaccinations before people board planes, just as they do before they go into restaurants or other crowded places. Relying on the ventilation systems within plane cabins, in my view, probably is not enough. And I want to hear again from the public health experts and others as to whether vaccination should be required. But I think erring on the side of caution is well advised at this point. Again, you know, you just heard from Dr. Wu about what the trend lines are. No one should be surprised by the increasing positive rates, by the presence of a new variant, by the hospitalization that are required. All of it was predicted. We can stop this pandemic if we do the right thing.
Senator, we haven't seen you since an event unfolded where you attended. This event, this group had ties to the Communist Party, and I wondered if you regretted your attendance and if you could speak on that.
If I had known all the details, I wouldn't have gone. I was invited by a number of labor unions to honor 3 extraordinarily impressive leaders, including a state senator and a pastor in Waterbury and a labor activist. And if I had known all the details, I wouldn't have gone.
It has been said, though, that you have one of the most experienced staff. You've been in the Senate for quite some time. Are you saying that they did not do their due diligence to find out where this group stood?
If I'd known all the details, I wouldn't have gone. I was invited by labor unions to be there. I go to a lot of places. In fact, I go almost everywhere I'm invited if I can be there. And I was there to honor these very impressive leaders.
Why would you not have gone? What is there about that group? They
I
believe in
would
many
not
of
have
the same
gone
things?
to the event because I would have found a different way to honor those leaders.
Getting back to Defense Production Act, has it been invoked during this 2-year period? It was early, right? For
It was.
tests and for masks, right? Is that right?
It was to provide certain kinds of equipment. As you'll recall, the gloves, ventilators, certain other kinds of equipment more than a year ago.
Now, given the demand right now for tests, and given that there's a lot of liquidity out there from both the federal government and privately, why is it needed? Why isn't this company in Connecticut just cranking up and selling as much as they can possibly make?
Well, what's needed is more capacity, more assembly lines, more machine tooling for the equipment that needs to be manufactured. And that kind of national effort requires the Defense Production Act just as it does in wartime. We should be on a wartime footing for the production of this essential equipment. Not just the masks as were required before, now we have enough masks. We need more testing equipment, and if we do the right thing, we can make use of all the capacity that America has.
I have a question for Dr. Wu about, could you just clarify what exactly you're looking at as you look at not just the numbers, but the degree of infection and so forth? You're statewide about 850, down from 1,200 a year ago, but obviously people are not vaccinated a year ago. What exactly are you looking at?
We're looking at all the numbers. I don't mean to be, comprehensive about it, but it's we're not just looking at percentage positivity. We're not just looking at hospitalizations. We're looking at ICUs. We're looking at ventilators. We are looking at deaths. So all these numbers we're looking at, and our only baseline is a comparison of the year before. But I don't think it's sufficient enough to say that we're doing better than last year, because it's still out there, and we're still going through a crisis at this point. But everything is relative, and relativity right now for COVID was a couple months ago. But we have to look at it in its totality, which is ever since the pandemic started. So it's not just one set of numbers that we're looking at. We're looking at, for lack of a better term, all of them.
Are people less sick now than they were a year ago? Per population, per 100 patients that you have, are you seeing less critical illness now than you were a year ago?
Well, I think all the numbers are less critical as compared to a year ago. But from my standpoint, we still have too many.
But per patient that's here, are they less critical? That is.
Per patient, it's like I said, to answer your question, it's less than last year, but it's still too much. So.
New York is reporting a surge in more children in the hospital with COVID. Is that something that you all are concerned about here in Connecticut?
I think we're always concerned when children are involved, as well as the general population. We do tend to mimic the numbers of our neighbors. So I would expect that if New York is having rising numbers, that we should probably subsequently see a rise ourselves. So.
Thank you, everyone.
Sure.
I'm not even sure. Because it's one of the ones that
Yeah,